Josh Ellis with the North Carolina News Network here to talk about the state health plan bill. Josh, how does the Senate Republican bill that passed compare with proposals put forth by Governor Perdue?
Somewhat similar. It does make some changes that pass some costs on the state employees and retirees, but does it in a little bit different way. The particularly main difference is the Republicans have tried to keep things like the copays down, but they've raised higher premiums on. There's also higher out-of-pocket expenses in the Republican Senate plan, and there's also does touch the retirees, something that they think is a necessary evil, essentially.
Let's start with current state workers, those who are not retired. What's the sentiment for making them pay some sort of premium, as you've heard Democrats and Republicans discuss this bill and the overall proposal?
I mean, the bottom line is the plan needs money. I mean, in addition to the $1.6 billion that they're spending each year, they need an additional $515 million to keep it running for the next 2 years. And the state is picking up a little bit, but those premiums and those out-of-pocket expenses are certainly going to go a long way. I think it's, do the math, around 75% of that is going to be passed on to the state employees.
The House of Representatives takes up this bill next. We've heard the line being drawn with retirees, at least from the Senate Democrats. How much of the future debate will revolve around whether or not retirees ought to pay something for their health care?
I mean, that's certainly going to be the debate. And I should also point out that, under this plan, the lower end plan, the 70-30 plan, is free, but the 80-20 is the one that retirees would have to pay. And there will be debate on, can we change that? But, the question is ultimately, if you change those numbers, you're changing costs, and someone's going to have to pick up the tab. Ultimately, it doesn't look like there's a lot of willingness for the state to be picking up much additional money. So we'll have to see how it works out.
I have to tell you, of course, I'm a UNC-TV employee. All you employees of the network are under the state health plan, or a lot of us are. So there's a disclaimer in case someone questions my questioning here. Now, will the premiums being paid by employees under this proposal be enough to fill the financial hole the state health plan seems to suffer every year?
I mean, it goes a long way. It's certainly a big chunk of it, but it's those out-of-pocket expenses also help close that gap. There is some taxpayer money that would be used, but it certainly does not entirely close it.
Josh Ellis, North Carolina Now News Network. You'll hear him on the radio. Thanks for being on the show.
Glad to be here.